Well, I grew up in New York City. I went to Oberlin College. It was the 60s. And I, like many other young people, baby boomers were becoming young adults. And there was a lot of idealism and activism. We had a very good community-oriented hospital, Montefiore Hospital in the Bronx, where I was going to medical school. They set up one of the first neighborhood health centers in the South Bronx. And I worked one summer in a project that was trying to create services for children. And I went around the South Bronx surveying people in their homes about what they wanted in a children's health service that was being developed at Montefiore. Walking around that neighborhood and talking to the people was a very valuable and enlightening opportunity for me to see the need and the lack of services that many people had. So I was interested in community health. But in medical school, I also got to a pediatric rotation, and I fell in love with pediatrics. So I decided that's what I wanted to do. One of the options was to work in the Public Health Service, the Uniform Service Commission Corps. One of the things that was very noticeable when I joined the Public Health Service in Washington is all of us who had a commission were called two-year officers, meaning that everyone expected you to leave in 2 years, which wasn't great for retention purposes. I went back and asked about why not have some of the doctors and dentists and so on working in the public health service, work in communities where there was a need. There were communities where advertising we need a doctor. When I became interested in the issue, I found a task force report that had been done 2 years earlier on what they called health manpower. And it documented with a lot of great data the maldistribution of health personnel. That is, that there were doctors in suburban areas, but there was a great shortage of doctors in rural and inner city areas. I spent the next 2 weeks writing a proposal, using the data and explaining the justification and how easy it would be and so on. Another fortuitous thing at that time was the invention of the Xerox machine. And I took full advantage of the Xerox machine in our office, made hundreds of copies of my proposal, and began distributing it. At that time, there were a lot of these two-year officers and other young officers and other people in the public health service who were interested in community health and making things better. They formed an organization called Health Employees for Change. They took on this proposal as one of their things they wanted to advocate for. The Student American Medical Association likewise supported it. Student Health Organization supported it. I passed the Senate, I think 98-2, or maybe it was unanimous. It was also passed overwhelmingly in the House. There were thousands and thousands of advocates by the time it got to the legislature. And I think they were very excited, and they kept their interest going. They didn't just say, oh, well, it's over, we'll go home. They made sure it was implemented. I think the addition of scholarship and loan program to the National Service Corps was the best thing that could have happened to that program, because it not only allowed it to continue and recruit people, but it opened the doors of professional schools to a lot of people who might not otherwise have been able to afford it. And beyond that, I think it might have created more interest in primary care. In addition to the maldistribution geographically in medicine, there's a maldistribution between specialists and primary care providers. By engaging young professionals in primary care and exposing them to what that's like and what it's not like, I'm hoping that at least some of the tens of thousands of people who take advantage of the loan and scholarship program wind up continuing their career in primary care. Well, the 50th anniversary is, to me, exciting, makes me proud and pleased. I don't think there's anything I've done other than raising two lovely daughters that pleases me more than having made the effort to write a proposal and promote the idea of a National Service Corps back in 1970. And 50 years later, I look back on it and feel, yeah, that was a good thing. I'm very pleased about that.